Hello, I'm Dr. Dolores Kent. I'm a consultant at Top Medical Center, located in the Grosvenor House Hotel in Dubai Marina. My previous practice was private practice in Beverly Hills, California, where I was also a gynecological surgeon and cosmetic surgeon for over 20 years. There are two commonly requested cosmetic procedures in cosmetic gynecology. One is vaginal rejuvenation and the second is labiaplasty. Vaginal rejuvenation is really basically a tightening of the vaginal area, or introitus as we call it. Very commonly after women deliver babies, they notice that their vaginas are more loose or they don't look the same as they did prior to having children. Sometimes it's just a genetic predisposition, but the vagina becomes less tight. So vaginal rejuvenation is a procedure that's really designed to correct this defect. We tighten the muscle, the skin, and the fascia, or the supportive tissue of the vagina, so that it's more secure for the patient and they feel more like they did before they had children. Labiaplasty is the second most commonly performed procedure, cosmetic gynecological procedure in the UAE today. Also, it's very popular worldwide. Part of this reason is because of the new popularity of waxing, where women actually remove all of their pubic hair. And labiaplasty generally refers to correction of the size of the labia minora, which are otherwise termed the lips of the vagina. The labia minora surround the opening of the vagina, and in many patients these labia are misshapen, they're elongated, they're thick, or they are irregular. Sometimes during childbearing, the tissue will tear. So they want it to look pretty, they want it to look neat, they want it to have a very clean appearance. The most common procedure done is really a trimming and reshaping of the labia minora, which really gives a prettier appearance to the entire area. Vaginal rejuvenation can correct the problem of loss of urine or urinary incontinence. Because the tissues are pulled and stretched after childbearing, the bladder falls out of place, and this causes the patient to lose the support for the bladder. So sometimes when she coughs or sneezes, she loses urine. Vaginal rejuvenation isn't designed to correct it. There are some traditional classic gynecological surgical procedures that are really designed to correct some vaginal syndromes that lead to something called prolapse, where the entire vagina or the uterus starts to fall through the vaginal opening. This cosmetic procedure is not really designed to correct these anatomical defects. It really needs to be emphasized that this is a cosmetic procedure. However, because the procedure was actually based on these traditional surgeries, sometimes we do get this benefit of eliminating the leakage of urine with coughing or sneezing. Labiaplasty also involves correction of the labia majora. The labia majora is the tissue just outside of that. This is also called the labia. And this area sometimes is thick or it's fatty, or it can also lose some of its tissue or turgor and it looks collapsed. Patients often want to have skin removed from this area so that it looks a little bit tighter and more neat. Sometimes if they have fatty tissue in this area, they want to have the fat removed so we can perform liposuction on this area. Or sometimes people even want to have it bulkier because they feel that it gives a more youthful appearance, and so we inject fat into this area. We can also sometimes tighten this area because it can become malformed or somewhat irregular after cesarean section or after childbearing. There are many procedures being invented today that are non-invasive. A lot of people really are looking for something that is less invasive than the surgical approach that will also work to correct and tightening and improving the appearance of the vaginal area. The problem is that these procedures are not time tested. There are very few numbers involved, and so we really don't know how effective they are. And my personal feeling is that the surgical procedure is really a much better procedure because we do have long-term results on this. We've been doing procedures similar to this for years, and we know that the results are good. The patients are pleased, has a long-lasting effect, and even in some cases, as I mentioned, a therapeutic effect on these patients.